Okay. Hello, ma'am. Good
Hello,
evening.
Ramya Ram.
Okay, you're from?
London.
Okay, so you came to us through a reference from one of my friend, and also your mother-in-law is our patient.
Yeah.
So you had multiple issues in your mouth, and you went to UK. You were in UK, and you went to the doctors. And what did they tell there?
Actually, right from the time I was pregnant with my son, who is 2 years and 2 months right now,
Uh-huh.
that tooth that you extracted, doctor, it was a very small cavity. It
Yeah.
was a very tiny cavity.
Uh-huh.
So it started aching when I was pregnant. So
Okay.
at that time, when I went to the doctor, they refused to treat me completely.
Mm-hmm.
So they said they can't do any root canal, they cannot offer me any extraction. They said that I'll have to take only paracetamol. And then COVID came. So at that time when I went back to them, they said since it's a surgical extraction, they cannot, the local surgery, the local dentist cannot do anything. They will have to refer me to a specialist hospital for the extraction and the wisdom tooth and everything. They said they just can't do anything. They have to refer me to the specialist hospital. And the doctor's appointment, my dentist appointment itself, they had only for Jan 15th, and this I'm talking about end of November. So they said the dentist will see you in Jan first week, Jan 18th, and then the specialist hospital appointment will be another 2-3 months from then. After I meet the doctor, another 2-3 months the specialist doctor appointment. So by that time, I would be in so much pain that I just cannot tolerate it at all. So it is too much time consuming there, and even the care that they provided was like they just said, okay, let's do this. So they didn't give me a proper treatment plan the way you gave me, doctor. Like you took an X-ray the first day, and then you told me these are the teeth that has to go for root canal, these are the teeth that has to be extracted, these teeth have to be crowned, and there are so many varieties of crowns and everything. They never gave us any of such.
What did they do?
They just said you will be filled, you will be given crown, we will extract, and that's it. They didn't tell anything, and they said you have to go there, you have to go here. So it was not like in one place, everything was in different places, and the time was because when you have dental pain and you saw how decayed my tooth was, doctor, so the pain was so horrible. So the treatment was not at all effective there. So
Okay, so it went well here, right?
absolutely.
So you had multiple treatments, a lot of root canals, a lot of extraction, a lot of fillings, and so many things to be done. How is the care in UK and all that other places? Because I used to think in abroad countries the healthcare is much better, but
Healthcare is definitely better, doctor, but not dentistry. Their dentistry is a separate industry.
That's the point.
Healthcare is a separate industry.
Achha.
So healthcare
Dentistry is not well.
Dentistry is not. Actually, in UK, dentists are the highest paid people, even more than, say, an FOCS surgeon, even more than a cancer surgeon. Dentists are the most highest paid in UK, actually.
But why the treatments are not as good as India?
The system is, doctor, every area will have 1 or 2 dentist office, and they'll have so many patients and very few dentists actually working on them. So the number of dentist surgeries, when they call it a surgery, it means a clinic. They call it dentist clinic as dentist surgery. So they have like 3 dentist surgery in our area, which covers like 10 miles.
Okay.
And imagine how many people, and this is London city, so the population is also so high, and just 3 clinics for like 10 miles is ridiculous. And they almost never have appointments, they don't have staff, and it is always overbooked, and because of COVID it is all the more worst. And then people below poverty line, they get free dental treatment, so they also come and pile up. So
Okay. So, moreover, a lot of difficulties.
absolutely.
Okay. So, how was your experience with Malligai Dental and our team?
It was very, very good, doctor.
So, you had a pleasant treatment
Absolutely.
and you had all your work done.
Yeah,
And would you recommend us to your friends?
absolutely, doctor. I wouldn't recommend any other dentist actually.
Okay, thank you.
One of my friend herself is a dentist here. She is now writing her exams and everything in the UK.
Oh,
She
good.
said she has heard of you. So
Okay.
I asked her even before the treatment started. So she said, go, eyes closed, you go to Dr. Praveen.
Oh, she knows me.
Yeah.
What's her name?
Jay Priya. She was an insurance doctor. She was not a
Oh,
practicing
okay,
dentist.
okay.
But she still knows you.
So most of us, they know us because I'm in the teaching side of dentistry.
definitely.
A lot of people comes to me for courses, learning things. And we have a fantastic center over here where we do a lot of surgeries and courses.
True, doctor.
And we are very active in our field. and we take part in various activities of dentistry, not only limited to basic stuff but hi-fi stuff like full mouth implants and all that. So thank you for trusting us, and
Thank you so much.
we were
It
so
was a
busy we
pleasure.
couldn't spend time with you. At least we find a time to talk to you and take
Sure.
your
It was a
valuable
pleasure.
feedback and everything. So thank you so
Definitely.
much
Thank
for
you,
your
doctor.
support and affection,
you,
your
doctor.
love and kindness towards us. Please recommend
Sure.
us to your UK
Absolutely.
friends also.
Absolutely.
And we will send you a Google review link also. Kindly
Sure.
drop us a link, and you and
Sure.
your husband has to do it for us. Thank you,
We
ma'am.
will, doctor.
Thank you.
Thank you, doctor.
Thank you. Take
Thank
care.
you.
Bye.
Thank you.